Another top story tonight. The maker of a powerful and sometimes deadly prescription painkiller will plead guilty to federal criminal charges. Purdue Pharma first released OxyContin back in '95. In the early 2000s, FDA officials say reports of overdose and deaths from opioids like OxyContin rose sharply. By 2009, FDA officials say more than 1 million ER visits were related to misuse or abuse of pharmaceuticals, an increase of more than 98% in just 5 years. In 2017, multiple federal agencies started investigating Purdue Pharma for its role in the opioid crisis.
Thank you, Rob. And the Purdue Pharma, the maker of the powerful painkiller OxyContin, has made that deal with federal prosecutors. The company is pleading guilty to 3 felony counts for its role in creating the country's opioid epidemic. The Connecticut-based company agreed to a settlement worth more than $8 billion.
The resolution here is very significant. It involves, for the company, 3 felony guilty pleas.
And it's a settlement that could help resolve thousands of lawsuits brought against Purdue Pharma for its role in a public health crisis the Centers for Disease Control estimates has killed nearly 500,000 Americans since 1999. Garrett Fox was nearly one of them, telling NewsNation last month about his battle with addiction that began when he was prescribed opioids after dental surgery.
It was just a hell on earth, man.
OxyContin hit the market in the mid-1990s, considered the drug that fueled the opioid epidemic. Purdue, the feds say, engaged in kickbacks along with misleading advertising. The settlement amount, $8.3 billion, will likely never be recovered because Purdue sought bankruptcy protection as the lawsuits started to pile up. It infuriates Connecticut's Attorney General.
I've said from the very beginning, one of the non-negotiable points for me and for this state is that Purdue and the Sacklers and their management get out of the opioid business, get out of the addiction business, and that we shut them down. This does not accomplish that.
Asked about that in Washington today, lawyers for the DOJ called this the best possible outcome.
This is a very substantial penalty for that conduct.
They also say the Sackler family, known for its wealth, estimated at more than $13 billion, is still exposed to future litigation and a criminal probe that does not end with this deal.
This resolution does not provide a criminal release or an agreement not to prosecute for any individual, and our criminal investigation regarding individuals is ongoing.
And as part of the settlement, Purdue Pharma will be run by a trust as a public benefit corporation with profits used to treat addiction.
For many people, this settlement today was a headline, a story that crossed their feed. But there are tens of thousands of faces directly tied to this story and the toll of this addiction. And for them, it's personal. Bill Green lives in a Chicago suburb. His son died of an opioid overdose on Christmas morning 2018. Alex was just 25. Bill is one of those faces impacted by this crisis. He spoke with us this afternoon. I can only imagine, Bill, what this as a father is like to live with, but I'm guessing that's really all you can do is live with this because you never get over it, do you?
No, it's never over. We have, my wife and I, we call them Alex days when Alex kind of gets in our head. And other than that, we just move on. And he was a good kid, and we miss him dearly. But, I mean, losing a child, you're not supposed to lose your children.
Bill, let's talk just briefly about what this settlement means. The company, and I know this might be hard to hear, but admits essentially that it illegally and misleadingly marketed its opioids. To someone like you and your family who had a direct impact by this, what does that mean to you?
Well, it's sad that they admit that they did that. At the same time, I've always been pretty rough on my kids as far as they're rough and tumble boys, and you gotta have to stand up to what what you did. But if when there's stuff that they don't know, I'm really at a loss of words today, period. I wish I had a better handle on this.
For people who haven't gone through it, Bill, what's it been like?
Every morning, seeing the empty room. You told me there, it breaks me up. without having him around, it's a loss. He's supposed to be there. He's supposed to be part of the family. He's supposed to be an uncle right now. I miss him.
I know you've tried to translate this pain into good, and for our viewers who didn't catch our first interview, tell them a little bit about the bill you're working on now to try to get passed in Illinois.
It's designed to assist making sure kids or just, well, I should say people, making sure that they get help when needed, I just really wish that they would get through. It's stuck in committee. It's been there, and now the fact that I believe that we're in the middle of an election, it kind of gets pushed aside. We just hope it gets through, and it might save somebody's life down the line, and obviously memories forever.
Does a settlement like this help you process what happened, or not really?
Not really. It's throwing money at something. You can't throw money at the loss of a child. But so it means it really doesn't hit it for me at all.
Bill Green, thank you for your time. Thanks for sharing some of it with us this afternoon. And here's to the love of a son and those who know its warmth. Thank you, my friend.
Thank you.
Boy.
Oh, incredible. Heartbreaking.
It helps to put a face on that.
Oh, yeah.
And Bill does it well. And he said, like a lot of parents, they didn't know their children were wrapped up in this. And what he said at the end was to hug your kids as hard as you can, and when they demand you let them go, hang on tighter. It's just, like I said, I can't imagine how they do it every day, to know that you have an empty room to go to, as he said. But huge problem, and he wasn't, I mean, this was an $8 billion settlement. Didn't even impact, you know, it could have been $100 billion.
Doesn't matter.
It's money compared to the life of your
Right,
child.
right,
It's
right.
nothing. But 400 to 500 people have died in this crisis in this country in the past 20 years. There's a lot of bills walking around.
Yes.
There's a lot of empty rooms because of this crisis. It's devastating, ravaging parts of this country.
Well, Bill, thank you for sharing your story and for the important work. We'll continue to follow it.